involved. Now, in today's Sunday Surgery, we're putting the spotlight on male infertility.
Yeah, often when we think of the causes of infertility, we focus on women, but as we're about to hear, men are just as likely to have similar problems. Here to tell us more, Dr David Robertson, a consultant in reproductive medicine from Bourn Hall, Dubai. Thank you so much indeed for being with us.
Thank you.
It's a subject that isn't discussed in the open enough, so it's very kind of you to come on down here and bring just an element of your expertise and experience. Let's start with the causes, if we can. The most common causes of male infertility. What are they?
Well, I think it's largely a lifestyle issue in many cases. I mean, you have to look at what do we mean by male infertility? And there's a whole range of problems, and many of them are very minor. A man may have a slightly reduced sperm count or slightly reduced motility, and indeed that's the commonest situation that we see. And very often that can be related to lifestyle, to diet, smoking, bad habits like that.
Yeah.
So that's the first thing that we would really address when we identify a minor problem.
Yeah.
Now, as Tom mentioned earlier, this is not a subject that's been discussed enough because, I mean, couples who have difficulty in having a child, they generally go to a gynecologist because the general notion is that the issue of infertility might be with the woman. But, I mean, just like that, there are several other misconceptions related to male infertility. What are some of the others?
Well, I mean, that's a very important point because, in fact, if you imagine how common fertility issues are, the commonly quoted figure is 1 in 6 of couples have some difficulty conceiving. And probably almost half of those that can be attributed to a male factor. In some cases there are problems on both sides, but half the couples we see, we can identify some kind of male factor problem. I think there is a reluctance to talk about it because it's seen as detracting perhaps from a man's manhood, his virility. And so there's an element of shame perhaps sometimes involved with it, which of course is not really the case at all. You can have the most virile, strong chap who has a poor sperm count, but it doesn't reflect on anything else.
You've worked extensively in the region, Qatar, Al Ain, and more recently with Bourn Hall here, an institution that is renowned for its work in fertility the world over. In terms of the research, the figures, the surveys that are being done here in the region at the moment, has that improved with time? What are the sort of findings telling us at the moment?
I think, in fact, male factor infertility is probably a little bit more common here. What we do see a lot of are quite severe problems where a man has very little sperm or indeed doesn't produce sperm at all. And certainly some research bears that out, and my own experience bears that out compared to working in the UK, for example.
Yeah. But interesting as well, during your time down in Al Ain, I mean, working within the communities, you can see a massive increase in the success rates as well amongst the patients.
Undoubtedly,
Yeah.
yes. I mean, it's changed dramatically over the years. I mean, I've been working in IVF since 1986, and when I know, I'm old. And when I first started, we had a terrible problem dealing with couples where there was a significant male factor problem because we had to depend on what were new techniques then and are now quite old. Now we have new techniques that enable us to secure a pregnancy in couples with really quite severe problems.
What are some of the symptoms that men need to look out for?
Well, very often they'll have no symptoms at all. I mean, I think that's the thing. People are often unaware of it. Certainly men that have any other general condition, I mean, diabetics, for example, are perhaps a bit more likely to have problems, and that's very relevant here because it's a very common problem here. Any other general illness may be associated with a decrease in fertility. But most of the problems we see, in fact, the man will not be aware of it in any way. He may have no symptoms at all.
Will he have any hormonal issues related to this? Because I mean, I've read somewhere that, I mean, there is a potentially life-threatening sort of cause of infertility. You can also get a tumor, is it true?
There are various tumours that can lead to hormonal deficiencies, that's certainly true. But hormonal deficiency is actually relatively uncommon. It's a small proportion of these men. And they're the ones that could be treated. They may have other symptoms as well, and they can be treated quite successfully with hormone replacement therapy.
What about age? Is that relevant when discussing infertility in males?
Up to a point, but you don't really see a huge drop-off in sperm quality until a man gets on a bit, really.
Yeah.
It's not really age-related.
Okay.
I mean, since you've been in the industry for such a long time, what would you say has been the advancement? I mean, is there enough treatment available today? Is this curable?
Well, many problems are not curable in the sense that you can give a chap some treatment and his sperm count comes back to normal, but there's very much more we can do to help the couple achieve a pregnancy. I mean, probably the biggest breakthrough in this particular area, which dates back to 1991, is where we can actually directly inject one single sperm into the woman's egg. And that's really what I'm talking about compared with when I started in this field, in that we could not get these very small numbers of sperm to fertilize eggs in IVF treatment. And now we do this routinely.
David, you mentioned earlier that element of reluctance maybe for people to discuss this subject, maybe even to come down and get a consultation with you or your colleagues at Bourn Hall or any of the medical institutions here. In terms of putting minds at peace as well, what is the testing process? Is it a grueling process or not?
Not at all. The first thing is simply to talk to the couple, to go through the various aspects of their medical history, which very often may not reveal anything at all, particularly with regard to the man. But I mean, testing a woman can be quite complicated. There are blood tests, there are more invasive tests, but it's actually quite easy for a man.
So
we just need a semen
empathetic
sample.
approach as well.
Yeah.
Yeah. And in terms of the sort of finding out more, I understand you and your colleagues run free fertility seminars and more.
We do regular seminars on a monthly basis, addressing various aspects of infertility. Yes, we do. We have one coming up this week, actually.
We'll post the details on our page right now, that's for sure.
Excellent. And my marketing manager will be very happy.
Well, Doctor, thank you so much for joining us on the show and discussing the subject with us. Well, if you'd like to get in touch with Dr. David, log on to our Facebook fan page, facebook.com/Studio One Live.
It's this Wednesday. It's the 18th at 7 p.m. That's when the next seminar is, so we'll get that up in just a few moments. Yes, thank you very much, Doc. We'll take a short break after that.